Good evening, everyone. This is Charles Moon, and I'm professional caregiver, and I'm taking care of one of the dementia patient. I feel to share my own experience and let people to know how to take care of dementia. And if you are already taking care of dementia, so this video will be help you to know more about dementia. So because some of the people are taking care of dementia at their home, or people they hire caregivers experience what kind of they can face, and if they are facing that is not something is a new, that is the dementia behaviors and challenges that the caregivers are facing or families are facing. And okay, one is a big challenge is to dementia deny to do everything whatever we want they do. For example, when we feed them and we give them water, we bring them to the bath, or on the bedtime we bring them to the bed for the rest, and then they will deny to do everything, and that is very normal, but yes, that is the very big challenge. Okay, then other thing they can deny for it the medication, so but we have to do that. So that is the skill and talent of the caregiver, how you confess your patient to they follow you, and you done your job nicely, very politely. And that is how you communicate with your patient, by talk, by physically, and by emotionally, by face impression, that all. So that one is depend on the caregiver. Okay, one is this challenge when the dementia deny to do things, and other thing, dementia patient they sick so fast and very easily, and that is another challenge. So now, because the one is that the age, the immune system is not enough strong, lungs infection, urine tract issues, constipation, and that one also because they are denying to drink enough water. For example, my patient he don't drink plain water, so he must drink something flavor. So I mix some flavor and then I give him intake. So because I'm long time caregiver of my patient, so I know how I can give him good intake. So others way this is very big challenge, because dementia yes they can deny because they do not have sense to feel thirsty or sense to feel hungry. Okay, that is another very big challenge, and there is a more and more challenging when you are a take full-time caregiver. You can feel, you can see, and you can face that all. And some another issue, sometimes dementia have health issue symptoms we can't see, but they are feeling inside, but they can't tell. And because when they are feeling inside, their mood, their behavior can be changed. Day you will wake up, you see your patient is suddenly changed. He was eating very well, but suddenly he tried to deny it. Today he is not eating anything, he is not talking much, he not explaining anything. So that is caregiver have to observe that maybe they have a headache, maybe yeah, they something they have body pain or joint pain something, but they can't explain. But because of that that issue, they can change their mood, their behavior, and then the all daily routine system they can disturb. So that caregiver have to find it, what is that. So once you find your elderly suddenly change, you must know something is wrong with him. So you have to observe that, but you can find it, and must be something is there. It's not mean, because dementia patient they don't do anything by purpose. Sometimes they looks, yes they are very normal, and then they're doing by purpose, but actually not. You must have to find something is wrong with them. Okay, now I will talk about another challenge, and that challenge is environment. Okay, environment, for example, we are young people, and we can be live in the cold environment, but the elderly can't be, their body is not strong enough, but they can't tell. So you have to see that, because if they are feeling cold, so they can sick so fast. So you have to feel that. Other in related to environment, they dementia have high falling risk. That is another very big challenge, because dementia first thing, because of confusion, they do not have a peace, they feel restless, so they like to walk a lot, because confusion the confusion running in their mind. So you have to prepare your living room, your living place, so remove that all which you think, if your patient fall down, so if he hit there, he can be get injured, normal or serious injured. Other thing, you have to prepare your emergency table. On that table, you have to keep one empty bag, some shirts, shorts, diaper, and your patient's all medicine must be on one table. If any emergency happen, your patient fall down and serious injured, or if they become unconscious, or anything happen at the night time or daytime, so if you are alone to look your patient, so on the same time you also have to live with your patient, you can't leave them alone. So in the same time, you also have to pack your things and call ambulance, because if you run to the patient, you forget something behind, that one is very difficult task also. So that time you no need to observe what are you taking, what are you going to forget. No, you just know whatever is on the table, you have to put on the bag and just go. But until ambulance is not reached to you, you have to live with your patient, you have to see, and you have to see according to your training what kind of is emergency and what you can do. Okay, now I will talk about the communication. Okay, communication is between and caregiver and the dementia patient is very important, and that communication is by talk, and sometimes it's not by talk, because your patient can't, if they are not able to talk, so the communication can be a other way, by observing, by noticing, by how they are moving today, what they feeling. So that way is very important. For example, my patient, if I ask my patient, let's we go, I will bring you for the shower, for the bath. So it's a very 100% sure he will ask no, because he don't want, when he listen the name of the bath, he will quickly deny, he cannot, don't want to go for bath. So what I ask him, uncle, let's we go for washing. So word washing is, then he will, he don't deny, he very quickly he get up, he hold my hand, and he walk to the bathroom. And then I ask him, uncle, take off the shirt, so then I will start him bath. So he very happily he take bath. Even he ask, okay, he have watch, so he say open watch, because can be spoiled. So he is ready to take bath. But how I bring him, I find it this way. When I ask him for the, let's go for the bath, the shower time, he deny. But once I ask him, it's a washing time, let's we wash hand, legs, everything, then he happy to go there. So the words, which words we speak to our patient, we see what they can accept and what they can deny. So we have to find it. That other thing, once dementia want to do something, like they want to go out and outside is raining, so you should not be ask them, we can't go out because outside is raining. It will be very uncomfortable for them, they can be feel anger, they can be mood can be changed, they can be say, okay, no, I must want to go. So that time you should not be asked, we can't go, we can say we can do it something else. So put the attention on somewhere else, divert to somewhere else, any other activity. Or you say, let's we make coffee and we enjoy our coffee. Or maybe we make it omelette and we can eat omelette first, and during that time, or maybe we watch TV, whatever you think, because you are, you know your patient better, so you know where is your patient's interest, so you can offer to your patient that thing until the rain is not stopped. That is only example, so you have to do that. Don't say to your patient, no, we can't do that. Just say we do it other thing, then we do this. And if you think you can, that is okay, fine to do that, then you do it after that. If no, after that your patient will be forget whatever he or she is demanding. So that is another key. So main thing is communication. You must have to know your patient. Okay, other thing, why I feel I'm a good caregiver and I'm taking care of very well of my patient. I found it few things, accept everything, no matter what you are facing and what your patient is doing. Keep continue doing. You should be have enough patience. Other thing, your mood must be very positive with your patient. Not only with your patient, even your whenever your patient look at you, you should be look okay. You know, should not be look tired or sad or some personal issue, and because of the personal issue your own mood will be broken or sad. No, you should be look positive. Other thing, during when you are taking care of the dementia patient, do not think about your personal issues, about your families or other side businesses or whatever. Don't think about it, keep it separate. No phone calls, nothing during that time when you are taking care of your patient, because you are already doing very stressful job. And if you have another family issue or any kind of stress, you will be fail to do this job. I'm very sure about it. So when we are taking care of the dementia patient, must be our full focus on our patient. No, so if our mind is divided to two sides, we will be can be say is a difficult job, more difficult than we facing. Another thing, keep it your life slow. Don't rush for anything. You are taking care of your dementia patient, you think you have a lot of time for your patient. It's not mean you look your time and you think after 1 hour 2 hour later you have to go back home, or you have to do this, you have to do that. No, you must be full focus on your patient. And then yes, in some cases this can be happen, you because some cases is easy, like slight dementia, or dementia is not aggressive and difficult. Some is very kind, polite, very silent, and there is a still challenging, maybe they can deny for to do things. But some is a really like aggressive behaviors. That one is depend on dementia patient, what kind of behaviors they have and they showing on each day. That is depend on that the behavior as well. So keep continue do your job, you are doing very well, and hope this video will be help you to do it more better and know about more dementia. And I will keep continue make more video about another topic, and I will see you in the next video again. Until, good luck and take care.